You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. With us, we have board-certified plastic surgeon, Dr. Paul Chasan. Dr. Chasan, welcome to the program.
Well, thank you, Randy.
Good. Now, I had you on the program, seemed like about 8 or 9 years ago.
That's about right.
And so thanks for coming back. And we've been trying to get you back on the show for quite some time. Now, for people that don't know you or your center in Del Mar, who's the typical patient and what are the different procedures you do?
Well, Randy, I do the full spectrum of cosmetic surgery, and that includes facial rejuvenation, breast surgery, body contouring, rhinoplasty, and all the non-invasive techniques of fillers and Botox and skin tightening treatments. And in my Del Mar practice, which I built out about 4 years ago, since we're reconnecting, I built out what I feel is the ultimate in the patient experience center that could, for any patient to come in and have the best experience.
So why is that so important?
Well, Randy, I think the patient experience, the result is the ultimate importance, but I think just almost as important is their experience getting there. And if I can control the environment in such a way that they have less postoperative nausea, they have less postoperative pain, they don't have to get in a car right after surgery and get jostled around and move in and out of a car and have the discomfort of that, and then they get nauseated getting home. If I can eliminate all that by having them catered to with a nurse for the whole night, and then the next day I come in, they feel great. And so the difference in that experience is enormous. And then we also have a daycare. So we do a lot of moms, and they bring their kids, and instead of, again, think about this experience, okay? You got your kid, you're coming to a 5-minute appointment, guard gate, parking lot, elevator, your kid screaming, or you pull up, you come to the office, your kid goes to the daycare, maybe you'll get a latte at Starbucks, and you come for your 5-minute appointment. I mean, to me, that's important.
I haven't been there, but you say it's a pretty big center. It's a large center.
It's full. It's a full plastic surgery center. We have 2 ORs, and it's, I think, in my opinion, maybe I'm biased, but probably the nicest plastic surgery experience there is.
Okay, so going on to today's topic, which is mommy makeover. Let's start with a working definition. I mean, what is a mommy makeover?
Well, the typical change is postpartum. Breasts after breastfeeding, sometimes they droop. A lot of times the breasts get post-gestational atrophy. They lose all the volume in the breast. Abdomens, a lot of times women's abdomen after kids get stretched out, particularly with C-sections, because after C-section, they actually divide the muscles, and then even if they close them, it's never quite the same. So typical after mommy makeovers, breast, abdomen, and after the surge of hormones, and this is something that people don't really talk about, the surge of hormones changes the physiology, and some areas of fat, like the hips and the flanks or the outer thighs, they get worse. And once that program gets changed, it's changed for life. So to answer your question, it's typically body contouring, whatever it takes, tummy tuck or liposuction or both, and breast augmentation, breast lift, those kinds of things.
Now, you told me in the green room, you said, Randy, this is the real mommy makeover.
Yes.
Elaborate on that.
Well, in today's world, you see all these marketing things, the mommy makeover, you click on it, and it's some diet or some, 10-minute ab type workout and stuff. Some of these women, a lot of my women are very active. They've had 3 kids. They work out like amazing. They're strong everywhere, but they just can't fix their abdomen. They can't fix it. They can't fix their breasts. And these are very fit women. In fact, I could show you some pictures. I don't know if you want to look at some pictures.
Yeah.
Let me show you this picture. And for example, this lady right here, if you look at her abdomen, she's pretty fit. But what's happened is her belly button has stretched out, and a lot of women, after having children, they get an outie, an umbilical hernia. Their muscles are stretched, and in fact, on the side view, if you look at this same woman, even though she's flexing, her abdomen still sticks out. Now, most of these women tell me they want to be able to wear a bikini again.
So on the consult, this is what they say.
Yes, they want to feel better in clothes. They want to be able to wear a bikini. They want to not be embarrassed going to the beach. And so those are the kinds of things I hear.
So when you look at an abdomen like this on the consult,
right,
what do you see, and what goes on in your head of what you need to do?
Randy, I've been practiced 20 years. I've fixed hundreds of these. And so in my mind, I'm looking at right away, what's the skin quality? Do they have a diastasis, which means the separation of the rectus abdominis muscles? So your two muscles that are down here, a lot of times they separate. Okay, so I'm looking. What do I have to fix? Do I have to get rid of skin? Do I have to get rid of fat? What's the skin quality? Am I fixing muscle?
So with her, what'd you do?
Well, on her, I did a complete mommy makeover. I did a tummy tuck, and I sutured her muscles back together. I got rid of her umbilical hernia. I know on your show you can't show breasts, but I did a breast augmentation, breast lift, and then I did a little liposuction of her inner and outer thighs. So Randy, look at the before and afters on this particular patient. If you look at a couple things, her incision is extremely low. Most of my women want to be able to wear low-cut jeans, have a bikini that is completely covered. That incision, I can tell you, after just several months, that incision is a non-incision. It's so light. And
so you like keeping them low?
I do. I actually employ a technique called progressive tension suturing. And I actually, underneath the flap, I suture the skin flap progressively so I can keep advancing that flap down lower and lower. And that allows me two things. It allows me to keep that incision very low and no tension on the incision. And we can talk about that, but keeping tension.
So no tension is just a thinner scar.
That's right. The less tension you can put on a scar, the better that incision is going to be. And so I pride myself on great incisions. And so if you can take tension off that incision, so the skin's just kissing, and then I can do just a fine microbite closure. And if you can put that skin perfectly opposed to each other, you have your best opportunity to get the best scar you can. And so whether it's a tummy tuck or a breast lift or a facelift, that concept of perfect closure, no tension on the closure is kind of what I do.
Now, you're big on continuing education.
Yes, I am.
I like what you said. You go to conferences, things like that, and you learn little tricks, little things for better results.
Yes, I do.
Is that right?
Yeah. I mean, I always call it mining for gold. I mean, I've been doing this a long time. I'm pretty solid at what I do, but what I do is I'm critical of my own results, and then I'm always going to meetings, a voracious reader, always looking for new techniques. How can I do it better? I'm always trying to be, how can I do it better? I've invented some techniques myself, and in a way that no one taught me this, but it just made sense. Or you have certain areas of surgery, you say, gosh, I wish I could do that better. How can I do that better? And so if you have that mindset through your whole career, you develop a certain skill set that I think sets you apart from your other colleagues.
And you do most of these procedures we're talking about just about every week.
Absolutely.
Is that right? So
yes,
when you were on my show the last time, are you that much better now than you were then, do you think?
Yeah, I think, you know what, I've always been able to get to beauty, but I think I can do it more efficiently and more reproducible now.
The mommy makeovers, we're calling them, and if you're just tuning in now, we're talking to board-certified plastic surgeon, Dr. Paul Chasan, and we're talking about tummy tucks, and we're going to talk about breast lifts in just a moment, but we're talking about natural results and low incisions, minimal scarring, tummy tucks.
For example, when I was on your show last, the progressive tension suturing technique wasn't even available. It wasn't even done.
Okay.
And so that's a new technique that I've adopted probably about 4 or 5 years ago, which just makes my tummy tucks better.
Stretch marks. How much of stretch marks can you get rid of?
You can remove a lot of stretch marks. In fact, sometimes I'm impressed by how much. Generally, if the stretch marks are below the belly button, they can be removed. For example, look at this picture. I mean, here's a gal who's had kids. There's no way she could possibly be in a bikini. Her abdomen's destroyed. And look at her, she's tan. Why? And look, she has a bikini tan line. I mean, this is the first time since having children that she could wear a bikini.
That's a fit abdomen.
Yeah,
you would never know she had something done.
Yeah. And
so are you doing a combination of lipo and a tummy tuck on most of these people?
Yeah, and I would say at least 80 or 90% of people who I do a tummy tuck on, I'm going to do lipo. In fact, just recently, there was a lady who I did liposuction of her abdomen and a tummy tuck. And that's another newer technique that people are always afraid to do liposuction and a tummy tuck on the same area. And that's been shown that you can do that. And so some people, I mean, this gal, she went from a size 8, that's conservative, she might even be a size 10. She's a 00 now. and she had liposuction of the abdomen, liposuction of the hips, and a tummy tuck.
Is this one of those things where sometimes they say, I should have done this years ago?
I think almost all of them feel that way. Some, the priority is their kids. And what I see is that they are totally tuned into their children, and then all of a sudden their kids are going to preschool, and then they're in first and second grade, and now the kids are a little bit more on autopilot, and then the women start to say, hey, it's my turn. And it seems like that's a natural progression.
It's a younger look as well. It's like they're getting a youthful body. They're getting the body, I guess, they used to have, and sometimes even better. That means they end up with a better body.
Oh, absolutely. I think that if you take someone who gets it and they work out and they live the healthy lifestyle, and then they have like tummy tuck and a little touch-up liposuction, maybe a small breast augmentation and a lift, they look amazing. They look amazing, and I think it's a wonderful thing. And in fact, today more than ever, we just have this whole barrage of new techniques just in the last 5 to 8 years that than any other time in history when somebody can regain their whole self-esteem and confidence and wear a bikini and go on vacation and feel great about themselves, where even 10 years ago you couldn't do that.
Do you see these types of transformations where people, they become different? Almost like they get their
mojo
back
going.
Or something?
That's what keeps me going. I love it. And it's like you come in and I'm smiling and I'm looking at them and they're looking at me and they're smiling, and it's a great experience.
When we talked on the telephone, we had a meeting, and you talked in terms of tummy tucks are craftsmanship. And you say that breast lifting is more of art. What do you mean by that when you say that?
Well, in what I do, there is definitely a craftsmanship side and artistic side. And some procedures require more artistic ability and some require more craftsmanship ability. So, when I talk in those terms, here's an example of craftsmanship. We talked earlier about taking tension off the incision. I'm obsessed with taking tension off the incision. I'm obsessed.
And you're obsessed with that because that's for the minimal scar and tummy tuck. Okay.
Lowest minimalist scar. Perfect closure. Those are craftsmanship issues because you don't have to be an artist to make a perfect closure. You have to have detail, attention to detail. Sometimes you finish a tummy tuck, and although the scar looks pretty good, you see one side's higher than another, or there's a little, what I call a handlebar. See, to me, that's unacceptable. And here's the craftsmanship side of it. Okay, Randy, when you're there, you're on the table, and I know that certain surgeons say, well, it'll stretch out, or that's okay, she'll be happy. See, for me, I can't do that. And
so you have buddies with this mentality.
A lot of guys have that mentality, and they do the surgery and the surgery's done. And for me, if I see that little handlebar, I'm going to take that extra 15 minutes and excise that little area and make it perfectly straight so they're perfectly symmetric. It's a perfect curvy linear line. That's craftsmanship. That's pride of ownership. That's saying to yourself, I want to go sleep tonight knowing I did the best job that I could do. Let me show you this other patient, because not all, the last couple patients are women who are generally thin. We do the full spectrum. Thin women who've had kids. Some women gain a lot of weight. Some women are heavy and they have kids, or they've gained a lot of weight. Their skin's been really stretched out. Here's an example of a mommy makeover. So in this particular patient, her abdomen has been destroyed with childbearing.
That's got to be unusual, what I'm looking at.
No, I see it all the time. And, it's kind of one of those things, it's the 800-pound gorilla in the corner for them. They're focused on their kids. They tend to hide their bodies. They wear non-revealing clothes. Their confidence is down. And year by year, it just stays like that. And I think a lot of these women don't even know that can be completely fixed. And so that's a destroyed abdomen. Skin is bad, stretched out. And, some of these women, all they want to do is just look better in clothes. And the fact is, if they could they can't even dream of wearing a bikini.
So when you saw her, did you think this is going to be good?
Yeah, I knew I was going to hit a good result on her.
It sounds like you almost said you knew you were going to hit a home run.
I knew that. Okay. When I looked at her, I knew I was going to hit a home run. And in fact, if you see her post-op results,
wow.
She has a bikini tan line. So this gal, the first she couldn't even dream. Her dream wasn't even to be in a bikini. I mean, that's so far outside what she was thinking. And now listen, think about how cool that is. This gal she's had three kids, and now she's in a bikini. She's in a bikini. How
now,
cool is that?
we can't show the breasts on this show, but her nipples are pointing straight down, and now. These are, and they can go to your website to see these.
Yeah, absolutely.
I mean,
She's on our website under Mommy
like perfectly
Makeover.
formed. In addition to this flat stomach, it is a huge transformation.
Transformation is the right word for that. And not only is it transformation physically, it's a transformation mentally. Self-esteem goes through the roof. These people, I can't tell you how many times you see someone who comes in and they're nice, dark, maybe depressed, and you know what? After about 2 or 3 weeks, when they really start to see the result, I mean, they're coming in, they're dancing in, they're happy, they're laughing. I mean, it is an amazing transformation, full spectrum.
And now, help me understand what you do in a tummy tuck with the muscles. Because, okay, so the muscles kind of give out, the abdominal muscles.
So
and you're bringing them back together.
Right.
How?
You have two what we call rectus abdominal muscles. They're about the size, each one of the size like a 2x4, here and here, okay? And when you flex, they stay flat. But if there's a stretching, and this is called diastasis, with pregnancy, especially with a C-section, sometimes I see a gap this far between the muscles. Now when they flex, nothing happens. Nothing happens. They can't flatten.
So it'll be a permanent little pooch out, even if she doesn't.
Even if they work out, no matter what they do, there's a permanent. So when you reestablish those muscles, when they flex, it creates the flatness. So
it's like a girdle in a way. You're sewing it together.
It's a good internal corset. That's a big part of a tummy tuck is providing that internal corset. When you can take a woman's abdomen and make it flat, now that's sexy. Okay.
Yeah. Yes.
And you know what's even more sexy is how women feel about themselves, the way they carry themselves, the way they dress. I have a 68-year-old lady. I did tummy tuck, I don't know, about 8-10 years ago. And actually a month ago I did a facelift and her arm lift. I mean, 60, now today's a different world. I mean, you'd never say, hey, someone 68 is hot. She's hot. I mean, she probably looks like she's in her mid-50s, and she's beautiful, and she carries herself well, she dresses well, she has a flat stomach, and now she has the face to match.
Now, we have to talk about breasts in a moment and what you're doing in a mommy makeover for breasts. But you have a picture of a larger patient.
Yeah, so, I mean, look, I deal with tall and short and heavy and thin and all over the spectrum. And for example, this patient, she's a bigger lady. She's a bigger lady. Super nice, 66. And she just said, you know, I've been working out. I've lost the weight. I need to have all that skin removed. And if you look there, she has a lot of extra skin. She doesn't feel good about herself. She can't, you know, again, the wearing the non-revealing clothes. And so I did what we call circumferential tummy tuck all the way around.
What does that mean?
Well, I not only do the front side, but you do the back side and you lift up her buttock.
Because on the before, like that muffin top, that whole thing.
Gone.
So you do 360. Is that right?
So no muffin top. And I mean, she can wear clothes that she wanted to wear.
Wow, look at this. That's a flat ab. I mean, that's perfectly flat.
Yeah. And so, for example, I think that just about anyone can be helped for a flat abdomen. I really do.
Are the patients, by the way, getting younger and younger or older and older for tummy tucks? Or is it a combination of both?
It's a combination. You have the recently postpartum moms, and then you have some women just at a phase in their life, they say, you know, there's many reasons. They feel comfortable, their kids are grown, and they start focusing on themselves or exercising for the first time. They're focused on themselves or exercising, and they realize they need help. And today, it's different. I have a 73-year-old lady who's a Pilates instructor, and she also does trapeze. I mean, this gal, 73, she's super outgoing and vivacious. I mean, when you initially think of 73, you think of Barbara Bush. But this lady doesn't look like Barbara Bush, and she's an attractive, youthful, vibrant person, and she wants to look good because she feels good. And so we see the young ones, we see the old ones, and you know, it really doesn't matter. They all feel better about
So
themselves.
a 32-year-old, 35-year-old may have this problem with their abdomen. That means for them, their stomach just kind of blew out after pregnancy. Is it better to get early treatment than later?
Well, that's a question, that's an individual question. I would say that most patients that I do these surgeries on wish they did it earlier, because that's just one more summer or 10 more summers they could have been in a bikini, enjoyed themselves, and not be hiding. So the answer to that question, I think that a 35-year-old or a 55-year-old would have pretty close to the same risks. But why, if you're 35 and you waited till you're 35, it's 20 years.
So if you're miserable about your abdomen,
and yeah,
you could do something about it.
Absolutely.
Okay, breast, and we're short on time here. So what are you typically doing to the breast on these with these patients?
So after childbirth and postpartum, the breasts have a specific change. A lot of times they lose volume. A lot of times asymmetry, drooping. So I would say on most kids, not all cases, sometimes I just do a breast augmentation. Sometimes I do augmentation and a lift. Sometimes it's just a lift. And sometimes it's evening out the breasts. I'll remove tissue from one breast so it's even with the other and put the same size implants. I think that's very important. Something I see all the time is if the breasts are asymmetric, then somebody will put a bigger implant in the smaller breast and a smaller implant in the bigger breast, and now you have the asymmetry looks weird because now they have a implanted look and one that's more natural. Even though they may be the same size, they look different. So I think one of the techniques I do is I like to put the same size implant and then remove the extra redundant breast tissue so they have the same size and shape breast. So it can be a combination in any and all those, and it really depends on their anatomy.
So on these lifts, on breast lifts, again, you are big on minimal incision, minimum scarring. Tell me about your technique there.
Well, when I finished residency, I went to Brazil for 2 weeks to learn their techniques for breast. And at that time, they were way ahead of us. I mean, in certain things they're not, in certain things they are. And the Brazilians had a way of doing breast lifting with less scarring, and I adopted that very early. And I still use that minimum tension, perfect closure thing, because I think a lot of women are really concerned about that vertical scar with the lift. So I think it's one of those things where their concern is here, and ultimately when it heals, the result's so good that it's not such an issue. But because it is a scar and it's a somewhat visible area, I'd like to make that scar the best it can be. And so I usually tell people that it takes 2 to 4 months for that scar to start maturing. After 4 months, that scar really can be, so minimal. And I would say most of my patients, even the most concerned patients, really don't have any issues with that scar.
Now, one of the things you said on the telephone, you said tummy tucks, Randy, are more craftsmanship. Breast aug's more artistic.
Breast lifts.
Breast lifts,
yeah.
Okay.
So a breast augmentation is a relatively simple procedure, creating a pocket, choosing your implant. You want to have ability and you want to be very particular about that. But breast lifting is all over the map, and I see a huge variety from really poor results to excellent results. And that shaping the breast and where the nipple position is and how the incision looks and the symmetry, I think all that requires a lot of artistic ability, and it requires a lot of craftsmanship. So when we talk about breast lifting, there's a huge variety of results that can occur. You can put the nipples in different places and that scar. So, I mean, that really requires some artistic ability, and you have to have an eye for that. I really like it. Important for me is when the breast takeoff comes off from the chest wall like that, instead of I see all these lifts and they still are drooping down there. I mean, I think most women if they're going to get lifted, they want their breast to be lifted and they want to look perky and youthful. And I think that requires that combination of artistic ability and that skill, and then the craftsmanship to make them symmetric, round to realist, and that scar to heal really well.
So a natural result. Now, is this true? You're known to some people as the revision guy.
Yeah.
That means when you had a complication or a problem with your breast lift, they go to you to have them redone. Is that true?
Yes. A lot of plastic surgeons in this city actually refer me their tough breast cases. And I've had you don't wake up one day and say, hey, I'm a revisionary specialist, but because I've developed a certain skill set and I've been attracted towards bigger cases and I've developed certain techniques for breast revision, I've been able to look at certain cases that other people say, I don't know how to fix this, and I know exactly how to fix that. And so when you do that as your livelihood, as your living, you get pretty good at doing that.
So breast lifting, you would put your work up against anyone's?
Anyone's, yeah.
You think I know you said, look, I don't want to talk about myself on the show, but do you feel that you're at the top of your game when it comes to breast lifting and getting natural results?
And that's just not me just saying that. That's years of trying to do it better and developing techniques to make that result better.
Okay, great. Now, and we are out of time. Mommy makeovers. You say there's a new thing you're adding in a mommy makeover these days.
Right.
A butt lift.
Well, Randy, I'm glad you brought that up, because the Brazilian butt lift is one of the best things that we have done in the last few years. And, you know, I've spent so many years contouring around the buttock, and that looks great, but the fat transplantation into the buttock works better than you would think. So you think, oh, you put a lot of fat in the butt, it's all going to die. No, for whatever reason, the gluteus maximus muscle is very gooey, sticky, vascular bed for fat, and so the fat just loves to live in there. And so the results, not only contouring around the butt, but actually taking that fat that you've removed down the butt and putting it in the buttock, it gives you this home run result. Let me show you a picture.
So you're adding their own fat, and we can't show this buttocks on TV.
But if you go on my website, you can look under Brazilian butt lift.
Because that is amazing right there.
Yeah, you can see that and see how not only have we contoured.
Well, it is like a lift.
And now like her waist is narrower and her butt's fuller. And that disparity, that contour, that proportion from waist to buttock really can look beautiful, like Kim Kardashian has.
So using their own fat, though.
Yes, it's their own fat.
Is this more for the thinner patient?
No, it's all over the map. Actually, it's more difficult for the thinner patient because sometimes they don't have the fat that you need. You need to be able to have some fat to harvest it to put in the buttock.
I want to thank you for coming on the show. So, final message. Somebody, they've had children, they're considering a mommy makeover, they're unhappy with their appearance. What do you say to them?
You know what? Now better than ever. It's a great time to get a mommy makeover. The techniques are so good. We're just seeing home run after home run. I've developed my skill and my skill set, but I think if you're unhappy with the appearance of your body, it's a great time to get a mommy makeover.
And we didn't talk a lot about liposuction, but you do a lot of liposuction.
I do.
On these tummy tucks. You say you're very aggressive with liposuction.
Yeah, I am. I tend to. And now aggressive means I like to remove as much fat as I can safely.
Okay, good. Thanks again for coming on the program.
Thanks, Randy.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.